Hi everyone, Whitney here from the Academy of Clinical Massage, and welcome to another of our Clinical Insights videos, where today we're going to be talking about why it's important to learn about various different conditions, especially pain and injury conditions in the orthopedic realm. Many massage therapists work with clients who have a variety of pain and injury conditions, and it's important for us to understand what might be happening in these conditions, because a lot of times there's something going on that might look like one thing when really there's something else going on there. There's also a number of other critical reasons why it's important to learn about these conditions, and we're going to delve into that in this video today. So let's take a look. Massage therapists are in a unique position in our healthcare system in that we have what's called direct access, which means anybody can walk in off the street to see us without going to see another healthcare professional first. And that's great for our business and for access that people have to using massage. But what it also means is we have a really important responsibility to make sure we understand the nature of what somebody's condition might be, and if this is even appropriate for massage to be used to address them. In many instances, they might need referral to another healthcare professional, and unless we really can identify some of the different signs and symptoms of what they're currently experiencing, we may not know if it's best for them to see us or if they really should be seeing somebody else. Now, in the world of musculoskeletal pain and injury conditions, we have all these names for a variety of different signs and symptoms that people may experience. And one of the questions I hear frequently is like, why should we be using all these names? Because we can't really diagnose these conditions. And that is an important distinction. As a massage therapist, we are not qualified to diagnose any specific pathological condition. So that means if a client comes in and has certain signs or symptoms, we can't tell them we think they have a particular condition, because that is diagnosing that condition, and that is outside of our scope of practice. But that doesn't mean we shouldn't go through some type of evaluation process to see if we understand what the nature of that problem might be. And number one, is it appropriate for massage to even be used to address that condition at all? And number two, if so, what's going to be the best strategy for us to use to address that problem? So that means we have to get an idea of what's going on there. And we use these names of conditions mainly so that we can just have a categorization of the variety of different signs and symptoms that a person may be experiencing. And so, for example, when we communicate with other healthcare professionals, if we say, for example, a person has carpal tunnel syndrome or subacromial impingement or patellar tendinosis, it's not that we're diagnosing that condition as much as we're saying, okay, we can speak a similar language here about what the nature of this problem is, and I understand the group of things that are happening here and some of the things that might have led to this condition and how we're going to approach it in treatment as well. So that assessment piece is critically important, and I have really found over the years that learning more about a variety of different conditions has really helped me in the assessment process, because I know if a certain group of signs and symptoms indicate something, let's say a person has pain when they do a certain group of motions or a particular type of evaluation procedure, that is common with this particular condition, but it's not so common with another condition. And that may really help us distinguish those things. And that's going to be an important factor that's going to guide our treatment as well. Another critical factor is something we call knowledge transfer. And this is how what we know about one type of condition may help us transfer that information or understanding to something that happens in another situation. So for example, let's say a client comes in with a certain group of signs or symptoms that might be indicative of maybe tenosynovitis in the ankle region. If we know what that is, we may also recognize that when it happens in another region of the body, like in the wrist and hand region, because that's another area where a tenosynovitis complaint would be likely to occur. So familiarity with some of these different signs or symptoms may help us recognize and appropriately identify what we should be doing and what kinds of things would be appropriate for massage when we see a condition in another area as well. As an educator, one of the things that I hear all the time from my fellow educators and from other clinicians as well is how important it is for us to develop clinical reasoning skills. And that means our ability to make clinical decisions based on good evidence and appropriate practice for what's going to be the best strategy to address that particular problem, or to identify what we think might be happening and how massage might interface with this particular problem. Learning about these different orthopedic conditions really helps you develop these clinical reasoning skills much more effectively. And that's one of the reasons that we focus on that so much in our training programs. Years ago, I realized that this focus on learning about conditions was a really good framework for our training programs to try to help teach and train massage therapists about treating a wide variety of pain problems that their clients might experience. So we built our orthopedic massage online programs around this model of learning about conditions because there's a couple of important reasons that really help that learning be even more effective. Number one, if you're doing this in a way that's really mimicking the real life scenarios, those learning experiences are going to be much more realistic and they're going to last and be much more effective for the learner as well. So the more the person can learn about real life scenarios and real life conditions and then apply that to the concepts that they're learning in the course, it's going to make that course a lot more effective for them. So we built our entire coursework around this model of learning about conditions, how to identify them, what they are, what are their characteristics, signs and symptoms, what's going to happen when you have a person that has this condition, when you palpate this particular area, when you move it in a certain direction. All of those things help give you a framework for understanding the nature of that problem, and then that's going to help you build and construct a more effective treatment plan as well. Our ideal goal is always to build the most effective treatment plan that can be unique for that particular client and also specifically tailored for their needs. So the more we understand about what's going on for them, and remember, most of the time, these conditions may not exist in isolation. It's very easy that you might have a person coming in who's got, one particular thing going on and another thing happening in another area, and those two things are interfacing with each other. They're not necessarily discrete, separated problems, but they're really interacting with each other. And so the more we can understand about the characteristics of each of those different problems, the better we can construct a treatment solution that's going to be ideal for that person. After working in an orthopedic clinic for a number of years, one of the things that became very apparent to me is there's a lot of situations where massage doesn't work. It doesn't really get very good results, or in some instances may even be detrimental. And once again, when I knew more about some of the different conditions, and in many instances, this was also learning not only about what was happening in this condition, but what was going on with the treatment that was given to that person, maybe from surgery or some other type of rehabilitation strategy that they're engaging in. What was going to be the most effective way for me to address that in that particular condition? So a lot of times we're trying to make those clinical decisions based on what is happening with other types of treatment. And the more we understand about the nature of that, it's going to, again, help us make better clinical decisions about what's the best strategy that we can do for that person from our own perspective. So again, just to recap, it's really important that you recognize when you use those names of conditions that we are not doing that from a standpoint of diagnosis. So be careful about how you talk about those conditions with your clients, so there isn't any way that this is misconstrued as giving them a diagnosis. And while we don't give a diagnosis, it is still crucially important to learn about these conditions so that we can recognize the nature of what type of problem might be happening in those soft tissues and know, number one, is it appropriate for massage to be used to address this condition? But also, secondly, if so, what's going to be the best strategy and most effective way that we can try to address that with that particular client? And we know that our treatment is often going to be uniquely tailored for each individual. So the more we know about what's going on with them and their particular condition, the better we can be at tailoring that treatment, ideally for what their needs are. So I hope that helps give some guidance about why it's so important to learn about these different conditions. Again, we've made all of our online course training programs in orthopedic massage focusing on this condition model because I really feel it's the most effective way to get the ideal treatment concepts across in a realistic framework that really mimics what you're going to be doing on a day-to-day basis. So make sure to click the like button and hit the subscribe button. Also, if you want to keep up to date with new videos coming out from us all the time, we try to put one out each week, giving some insights about clinical things that are going to be beneficial for your massage practice. And if you want to learn more about the courses that we offer, head on over to our website at academyofclinicalmassage.com, where you can learn about a wide variety of courses and approaches that we have for helping you be able to help people get out of pain. We'll see you in the next video.